Leprosy is a disease which already exists for a few centuries. It is known that the incidence of leprosy is reduced in the past years. Some countries even claim that they have eliminated leprosy, which means that the prevalence is below 1 case per 1,000 people in their population. But why are we so interested in this topic, and what is leprosy actually? Let's start with the first question. As said in the beginning, some countries claim that they have eliminated leprosy from the country. If you search for information about leprosy in Kenya, you will find a report from the WHO, which says that leprosy is not reported. However, during our trip in Kenya, we saw quite a lot of patients with leprosy. A lot of doctors in Kenya don't recognize the typical symptoms, so it's difficult for patients to find out that they suffer from leprosy. To answer the question what leprosy is, we asked Dr. Colette van Hees, dermatologist from Erasmus Medical Center, to tell us more about this topic.
Yes, my name is Colette van Hees. I'm a dermatologist. I trained in Leiden University, and after I finished my training as a dermatologist, I moved to Zimbabwe and worked there as a dermatologist for 4 years. Since then, I've always been working in tropical and ethnic dermatology, and have been visiting Malawi and Tanzania up to now.
Can you tell us what leprosy is exactly?
Leprosy is an infectious disease, so it's an infection of usually skin and nerves. And the bacteria, Mycobacterium leprae, invades the skin and the nerves and causes damage by itself, but also damage as a result of the body's immune reaction to the bacteria. Yeah.
And can you tell us something about the symptoms of leprosy?
Yes, there are actually, per definition, 3 cardinal signs of leprosy. There are skin signs, nerve signs, and there's the finding of the bacteria in one way or another, which are all, one of those 3 criteria are needed to diagnose leprosy. The skin sign, what's typical for the skin sign is to find a skin patch, and a patch may be just a discoloration of the skin or a slightly raised, usually round or oval lesion on the skin, of which it's typical that there is loss of the sense of fine touch within that skin lesion. That's the first cardinal sign. If you find that, your diagnosis is leprosy per se. The second sign is thickening of a peripheral nerve, and there are several nerves which are more common to be affected with leprosy than others, and the most common ones are the ulnar nerve, this one here, and the common peroneal nerve at the side of the leg of the knee. They can be thickened, painful, or they can be loss of function of the nerve, which is the function of that nerve, which can be motor function, so muscle function, or sensitivity. That's the second sign. The third sign is finding of the bacteria. And finding the bacteria is not so easy, usually. It's not something you can just out in the field, you can easily do. If you try, you can find it with a skin smear, which is making a small cut in this, either in a patch or in several defined areas of skin, such as the earlobes. It's making a small cut, taking out a smear with a knife, putting it on a slide, and looking for acid-fast bacilli. But you can imagine in the field that's difficult. In my country, in Holland, for example, we can use a PCR in skin biopsies or in skin smears. And we can even use serology. The problem is that one of these signs, or 2 or 3 of these signs, can be present, but sometimes only one. You definitely do not always find the bacteria. And that's what makes the diagnosis of leprosy so complicated. You do not always find bacteria, you do not always find nerve signs, you do not always find skin signs. So one of the 3 can be there, but the clinical presentation can be very varied.
And can you tell us something about the different types of leprosy?
Yes, there are different types of leprosy. You can divide them according to the reaction of the immune system to leprosy bacteria. So you have a spectrum. The bacteria are here. If you have a really well-developed cellular reaction, immune reaction to the bacteria, you'll find that the lesions, the skin symptoms, which is what most people do have and which are visible, are contained. So they will be on very few places of the body, or asymmetrical on one side of the body. Those areas or those patches where there is a good immune response, those are the ones that exhibit the loss of sensation. So those are your cardinal sign number 1 on the tuberculoid, what we call the tuberculoid side of the spectrum, which means there's a good immune response. So that's the clinical signs. As your immune response is less effective, you move up towards the lepromatous side of the spectrum. So you have a tuberculoid leprosy and you have lepromatous leprosy. And then there are some borderline forms in between. Tuberculoid, good cellular immune response. Lepromatous, no immune response at all. No effective immune response, no cellular immune response. This means that the bacteria symmetrically divide all over the body and all over the nerves. As a patient's immune reaction to the bacteria can change, which means that someone can move from somewhere on the lepromatous side of the spectrum towards the tuberculoid side of the spectrum as they develop more immune reaction. And you would think that's a positive thing. In one sense it is, because you get more reaction to the bacteria, but there's collateral damage. The immune reaction damages the nerves, and that's something that you really have to realize. So clinically, on the side with a good cellular immunity, there's loss of sensation in well-defined, contained skin patches and nerves, usually at the same side. No cellular immune response. More bacteria, more symmetrically spread out all over the body, because there's nothing happening to fight that. And those are the cases, the severe cases, where you also find loss of eyebrows, you'll find diffuse swelling of the face. Those people look younger than they actually are because all their wrinkles are gone. And so some of those people might even complain when you treat them because they look older.
Mr. Daniel Masiniko is 48 years old and comes from Tembul, a village in Kenya. In 1995, the first symptoms appeared. He started experiencing dry hands and feet and a loss of sensation in his hands and feet. When he came to the hospital in 2013, the doctors thought he was having tuberculosis. He got some TB medicines for 11 months, but these didn't help him, so they sent him home. Thanks to a program to find leprosy patients in Kenya, Daniel found out he was having leprosy in 2018. He had an enlarged peripheral nerve, facial palsy, sunken nose, various ulcers, dry hands and feet, and spots with loss of sensitivity. In laboratory diagnostics, they found antibodies for leprosy and a positive nasal smear for PCR on leprosy. When he heard he was having leprosy, he didn't tell anybody about this, not even his own wife. Daniel's wife didn't know what was wrong with Daniel, so she left him. Now Daniel is feeling fine. He is happy with the medicine and keeps taking them. He uses antibiotics for leprosy and omotherapy for the wounds and ulcers. This has helped him a lot. He has less pain and symptoms are not getting worse.
The treatment, as in any infection, is primarily antibiotics. And it's a combination of antibiotics, just like with tuberculosis, which is much more commonly known. You need a combination of antibiotics because of the different way in which it influences the bacteria. But that's not all. Antibiotics may be enough, but you may also need immune suppressants because of the immune reaction of the body to leprosy bacteria. And those immune reactions are actually really important. If you don't recognize them, they can be the main cause of damage to the nerves.
What type of antibiotics are used to treat leprosy?
There are 3 types of antibiotics. The WHO provides standard antibiotics for anybody in the world, whether they are in a low-income country or in a developed country like we are in. They provide strips, monthly strips of a combination of 3 antibiotics: rifampicin, clofazimine and dapsone.
And how is leprosy transmitted?
The bacteria is transmitted by droplet infection. So that means if somebody coughs or sneezes, they can infect another person. That doesn't mean the other person gets sick. So if you go to a leprosy endemic area, you'll find that 10% of the people might have positive swabs of their nose. If you do a swab of the nose and you look for the acid-fast bacilli, you'll find them in 10% of those people. But the large majority of those people never get sick because you clear the infection. So it's not very infectious at all.
And can you tell us something about the prevalence of leprosy worldwide comparing to Africa?
Well, the prevalence of leprosy worldwide is about 200,000 registered cases. We believe that there are many more which are not diagnosed or are not at this moment being treated, because the definition, the registered prevalence definition as used by the WHO and as you'll find in all the publications, is people under treatment. Is based on people under treatment, leprosy patients under treatment. So if you are not being treated, you're not in the books. So worldwide global prevalence in the books is about 200,000. The incidence is the same, new case detection is the same, and that implies very clearly that there is still transmission, because actually the new case detection has remained stable over the last at least a decade. So even though the prevalence came down, if the incidence remains the same, that means there's just as much transmission as there was before, and there must be hidden cases. Now, which are the countries, to answer your question about Africa, which have the highest prevalence? That's Brazil and India. But there are several countries in Africa.
This woman is 54 years old, and she has leprosy too. The symptoms started a long time ago, after she gave birth to her second child. It started with a swelling of the hands, and it spread from the hand to almost the back. This woman was diagnosed as a leprosy patient in the same program as Daniel. During investigation, they saw that the left arm was swollen. They also saw seriously mutilated hands. She told us that after some time, the bones and muscles of her finger started to disappear. However, the woman still managed to use her hands a lot. During physical examination, they also found an enlarged peripheral nerve. The other cardinal signs were negative. She went to a hospital and they said there was nothing they could do. They were not able to treat it. She has visited another place as well. Unfortunately, they told her the same. When a leprosy team from the study program came, she heard for the first time that she suffers from leprosy. She was able to take the medicines, and as a result of that, the swelling reduced. She also uses the Omo bath to make sure her wounds heal. Her family was happy when she told about her diagnosis, because they finally found out and they were able to treat her. But other people in the neighborhood were criticizing her because of the taboo on leprosy. They would not come close to her anymore. Luckily, after taking the drugs, they started to come close again. As a result of this disease, There are a lot of things she's not able to do anymore. She can't cook and she can't burn the charcoal, for example. She takes her drugs and stays at home the whole day. Still, she is feeling very well. She would advise all the patients to go to this place, Sirewa, to get drugs because she is feeling better now.
And can you tell us something about the unawareness of leprosy even among doctors?
Well, because it's, as you hear by the numbers, the prevalence, it's not, the numbers are not very large. You know, a lot of doctors have never ever seen a patient with leprosy and haven't learned to manage a patient with leprosy. The second problem is that the clinical presentation is so diverse. It could be a few patches, and if you don't think of looking for loss of sensation, it just looks like eczema or something else. It could be just nerve systems.
And what do you think about the taboo on leprosy, especially in Africa? Can you tell a little bit about it?
About the stigma?
Yes.
Yeah. I think the stigma is worldwide. It's not just Africa. It's in India, it's in Brazil, it's in Europe. The stigma is very sad because it's one of the reasons why patients are referred late. And I mean, or go to doctors late because they don't want to actually know that they have leprosy, even if they might think they have leprosy, and it might have great problems. It might give them great problems to have that diagnosis because people stigmatize them. They might not want to be in contact with them. Kids would have to be taken out of school. There's a kind of a biblical curse on people with leprosy, which they feel very strongly, and in almost any society is felt in a society. It's related to poverty, but also to a punishment. So nobody really knows why. I think people don't really know why they are afraid, but they are afraid of people with leprosy. They're afraid that they might get it, and they feel they shun these people.
So
yeah.
do you have an idea about what can be done
about that?
About stigma?
Well, the only thing that you can do is educate. You find that people are very not knowledgeable about leprosy, and that's actually the biggest problem. You have to explain that it's just an infectious disease like a flu or something else, but much less infectious than any other infectious disease that you can think of.
Leprosy, an infectious disease which affects the skin, peripheral nerves, limbs, and eyes. Some countries claim that they have eliminated leprosy. However, we have seen that is not the case in West Pokot, Kenya. The WHO launched a program in 2016, the Global Leprosy Strategy 2016-2020, accelerating towards a leprosy-free world. Let's hope that one day the world is leprosy-free.